Then we go to another entity, Angiomyofibroblastoma, AMFB. So this is a benign genital stromal tumor composed of fibroblasts oriented around prominent capillary vasculature. Occurs in women between 35 to 60 years old. And it also common sign is vulva and vagina. This is when it's slow growing. And then from the growth sample, it should be well circumscribed compared to the deep angiomyxoma kind of infiltrated border. And the microscopic feature is alternative zoom of cellularity. So that means in this lesion, you may see some hypercellularity area and hypocellular area, and then also prominent vascular components with red blood cell extravasation. And this entity called blastoma, I think, because they have this plump epithelial ophoplasmacytoid cells, not as spindle as the entity we have seen before. And then the vessel also thin wall. You won't see this hyalinized capillary. And then for this one, for the myoid bundle, that means the small muscle cell kind of forming this vesicle will be really prominent compared to other entity, even for the first one we mentioned, deep angiomyxoma. So you can see we have hypocellular area and also hypercellular area. And then even in this low power, you can see this vesicular growth, smooth muscle forming really long myoid bundle for this entity. Then more classic features, just like in this hypocellular stromal area, we have this small capillary vessel. And then around this vessel, usually we grow this tumor cell, more plump, spindly looking. They kind of aggregates, forming this kind of lobular looking. Then this is the high power feature to show this plump. Maybe the cytoplasm kind of spindle, but the nucleus kind of more plump, not like the previous you see. But the immunostaining kind of really similar to the like the deep angiomyxoma. Also, that's mean ER/PR positive variable CD34, and then also this transfusion MTG1 CYP2E1 identified 10 out of 11. So maybe this one is really characteristic, but I think for the practical purposes, I don't think we have this fusion. Okay. Then we see this virtual slide. We've already seen this picture before. We have alternative cellularity. That means some area really hypocellular. And then some area we have tons of cells. Then I just wanted to show you this really characteristic myoid bundle. You can see this one really catch your eye when you see this. Adjacent to blood vessel, we have this long vesicular growth. It's really long. So this one is really characteristic for this one, even better than the deep angiomyxoma. So for the hypercellular area, we can see this blood vessel and then all of these tumor cell, plump looking spindle cell, just aggregates in this hypercellular blood vessel area. Another one, even in this low power, we can see, kind of like vesicular growth pattern. And then some hypocellular area and hypercellular area. And then zoom in, we can see this like small muscle just forming this long vesicle. That's it for this entity.